My name is Dr. Bertrand Kaper. I'm an orthopedic surgeon here at Honor Health Thompson Peak. I specialize in total joint replacement surgery. My day-to-day practice basically involves taking care of patients who have arthritis. Arthritis is an interesting condition in the sense that the lay public often doesn't exactly know what it is. It's a phrase that's used very commonly. Cocktail party talk, people say, oh, I have arthritis in my hip or my knee or my shoulder. But really what I spend time doing is educating patients about what arthritis is. So arthritis by definition means that the cartilage inside the joint that's bothering the patient is deteriorating. In other words, it's wearing out. And ultimately that can go through varying stages and lead to what we call a bone-on-bone condition where there's no cartilage left in that joint. Arthritis is not just a disease of the elderly. Yes, it's certainly more prevalent when patients get older. The more miles we put on our hips and knees, as I like to say, often dictates whether or not the hip or the knee wears out. But we certainly see younger and younger patients these days who perhaps have had injuries, a skiing accident or a football injury that led to arthritis of a shoulder or a hip or a knee that then brings them in for treatment much sooner, other than our typical 65, 70-year-old patient who comes in with wear and tear type of arthritis. The decision of a patient to come in for an evaluation, there are a lot of factors in that. And I think there are a lot of people sitting on the sidelines who have a sore hip or a knee or a shoulder because they're intimidated by coming to see an orthopedic surgeon. And what I clarify with patients is that we don't manage everybody with surgery. In other words, if a patient is having pain or stiffness or they're limping and those symptoms are affecting their day-to-day function, which I then translate and say, well, that's affecting your quality of life. In other words, what you want to do, whether it's, be able to walk at the mall or play with the grandkids or keep up on the hiking trails or whatever, golf course, whatever people like to do. If they're choosing not to do that due to their arthritic symptoms, to me, it's logical that they should come in for an evaluation. And sometimes we'll say, yeah, your arthritis is mild or moderate, it's not severe, therefore needing a joint replacement surgery yet. And then we can help direct them for treatments such as medications or physical therapy, those type of things. So I think people will benefit from a consult with an arthritis specialist like myself or one of my orthopedic colleagues, just because we can help them understand exactly what the problem is and then what their treatment options are going to be. Honor Health is very committed to providing top-of-the-line, new technology care that's just overall going to provide a much better experience for the patient. So for more information about arthritis and treatment, I would encourage everybody to check out our website.